Hello and welcome to Good Day Street Talk. Antwan Lewis reporting. Here's what we're working on today. We're talking stories of empowering women. We're going to hear from a model who is using her experience in the industry to help others build self-esteem. And then a little bit later, the woman who created a clothing store promoting size diversity awareness. We're going to tell you why it's making such a big impact. But first, another example of women empowerment. Dr. Marilyn Fraser is the Chief Executive Officer at the Ashe Institute for Urban Health, and she is here with us this morning. Nice to meet you.
Nice to meet you.
We're going to get into what you all do and oversee the initiatives at the Institute, but first just tell me, how did you decide to pursue the field of health and science?
Oh my goodness, I always was interested in health and health disparities and health issues within the community. I wanted to save the world,
okay.
so to speak. I wanted to do that. I wanted to make people better and make sure that as a doctor, I was able to do that. So that's how I got into that. And then later on, my career path sort of diverted and brought me to the Institute, where I do community health empowerment.
So we know that the Institute is named after the legendary tennis. Legend doesn't even describe Arthur Ashe and the impact and the barriers that he broke. He's also from Richmond, Virginia.
Yes.
I'm from Norfolk, so we're very proud of him in Virginia. But the Institute, let's talk about what you all do there collectively, and then we'll talk about your role within the realm.
So the Institute does probably two major programs. One is our community engagement, community outreach program, where we go into beauty salons and barbershops and train stylists and barbers to deliver health messages to their customers. And this is part of our innovative work that we do within the community. The second program is our Health Science Academy, and this is for students that are interested in the health professions. So they come from grades 10 through 12, and they learn various things about anatomy, physiology, get to do dissections and those kinds of things.
So what's been the response, from within the community, and then secondarily from parents, what feedback you've heard?
So parents are usually really happy to have their students participate in the program. It is a commitment. It's a 3-year commitment they're making, and our students go on to do well, and they go on to the sciences and graduate earlier than the national average, so we're really proud of that. In terms of our community outreach programs, the folks are really interested in doing that, and the barbers and stylists get an opportunity to weave health into the beauty world that they're part of.
Now, how old is the Institute? It's about 20?
The Institute is 25, going on 26 years.
Okay.
So in December, we'll be 26,
A quarter century old.
A quarter century old, and we've done so much. And we're getting ready to have our annual fundraiser in a couple of weeks in October, on October 11th. Is
there any direction that you all are looking into going that you haven't already gone before in the last 25 years? Like, whatever you can share with us, like discussions like, we need to tap into this, or maybe
yes. Oh my goodness, yes. There's so many things that we want to tap into. We want to expand our programs. We haven't done much in mental health, and that's something that we would like to do more of. We partner with community-based organizations across New York City as a part of a health transformation initiative. And so we would like to do more of that in community health empowerment.
I think, that's kind of timely, given the stories that we hear about the children that you're trying to get early, and and in this age of social media and bullying and online things, and children are harming themselves, and keeping it inside, not going to parents or advocates or even administrators in school to talk about it. And a lot of them are harming themselves to the end that suicide is what's going on. And anybody that has a heart, I think it saddens us to know that. It
saddens us that this is going on, and you hear so much more about mental illness. There's still stigma that's associated with it, that people may not seek help that's needed.
Right.
And so making sure that we go into communities, we transform communities, and making sure that our messages are tailored to the communities, that it's easily accepted.
You're also talking about the diversity that's going on, and we also know that we're all trying to increase better eating habits.
Yes.
Has that been a tough sell amongst a generation who doesn't quite understand why fried may not be the first way you should reach to have the food prepared?
People are getting better. We're getting better in terms of the food.
I like how you cautiously, you took a breath before you said that.
People are getting better. I think one of the challenges is when you tell people to change and you do not provide a way of changing. So how do they prepare the meal that would taste similar to what they're used to, and it doesn't, it doesn't take away the taste, but the nutritional value is still there.
Okay.
But they're getting better.
Okay, that also along with letting them know that soda in any capacity
Yes,
is
the
not
sugar.
you know,
The sugars in soda, and when we look at obesity, childhood obesity, and those are the problems that we want to really deal with and tap into. We already talk a lot about cardiovascular disease at the Institute and looking at diet and exercise, and then also how culture plays a role too, because you know, people may eat different foods, and how do you provide substitutes that are appropriate for folks.
So now clearly the Institute honors the legacy, you know, of Arthur Ashe. Is there a tennis connection at all there, you know, within it, you know, in any capacity?
So there's a tennis connection. One of the things, the USTA usually donates scholarships for our students, our high school students, each year. And so that's one of our tennis connections there with the UST. And we are trying to do more with the Junior Tennis League that Arthur founded as well.
What's the website for anyone looking for information, you know, with
www.arthurasheinstitute.org.
And anyone interested in the academy and any of the programs, all of that information is there?
All of that information
and the
is
schools,
there.
the 12 schools that you mentioned, that are, all of that's there?
Yes.
Dr. Fraser, nice to meet you, and good
It's a pleasure.
work.
Thank you so much.
Come back and talk to us and tell everybody we said hi.
I will. Thank you.
All right, everybody.